I'm Giacomo Vivanti from the Drexel Autism Institute, and I'm going to talk about a study on social inclusion that I have conducted with colleagues at La Trobe University and the UC Davis Mind Institute. One of the most debated issues in our field is whether children with autism should be educated in inclusive or specialized settings. As a growing number of toddlers are diagnosed with autism, this issue is becoming increasingly relevant through the implementation of early intervention programs. Well, despite the importance of this issue, there is surprisingly little scientific evidence on the relative benefits of inclusive versus specialized settings for the education of young children with autism. And so my colleagues and I have conducted a pilot randomized controlled trial to test the outcomes of receiving a manualized early intervention program in inclusive versus specialized classrooms within community childcare services. The specific early intervention model that we used in the trial was the group-based adaptation of the Early Start Denver model, which is a naturalistic developmental behavioral intervention. As you can see in Figure 1, we randomly assigned 44 preschoolers with autism between the ages of 15 and 32 months to receive the Group Early Start Denver model across one school calendar year in classrooms that included only children with ASD or mostly children who were typically developing. Our first question was whether the implementation of the group ESDM in inclusive settings was at all feasible. And as you can see in Figure 2, results from a standardized classroom observation measure indicated that the quality of learning experience offered to children in the classrooms where the group ESDM was implemented was rated as being above the national average across both the specialized and the inclusive settings. We also found that it was more difficult for staff in the inclusive classrooms to implement this program compared to staff in the specialized classrooms, but they ultimately learned to deliver the intervention at an acceptable level of fidelity when support and training was provided. Across the school year, we saw improvements in both groups, with significant changes in the frequency of spontaneous communication, social interaction, and imitation, and across standardized measures of verbal cognition, adaptive behavior, and autism symptom severity. These improvements were irrespective of intervention setting. Mothers of participants experienced a reduction in stress, which was also irrespective of child intervention setting. So overall, the delivery of the group ESDM in an inclusive setting appeared to be feasible, with comparable benefits when the program was implemented in inclusive and specialized classrooms. You can read more about the article in the journal Autism on their website, which you can see here. Thank you for listening.